We're doing some renovation work, which makes it very challenging and distracting for all. So we'll just get that sorted out for you before we commence. Sounds like we have silence now. So again, good morning, everybody, and thanks very much for taking time out of your schedules to come to police headquarters and to accommodate my schedule. This has been a busy time for all emergency leaders, and particularly for our community and governors in our community. So I want to take this opportunity to thank you. And I want to talk a little bit about policing and the impact of what's been happening and transitioning. Of course, we take our lead from public health, from Dr. Wang, who's our medical officer of health. We've been working very closely with public health and the emergency control group. We have a meeting later today that our service participates in, and our operational support division that oversees major events and emergency planning has been actively engaged in many community dialogues because this just isn't about one event. It's around community safety, it's around public safety, and my responsibility as the chief to ensure business continuity of policing in the region as we deal with COVID-19. And so I want to talk a little bit about that. A lot of our work this week as a police service has been around how do we as a police service ensure business continuity, ensure a high level of policing as we deal with some of the challenges that we're facing. We're seeing some significant changes. And as you know, that in the last 48 hours to 72 hours in Ontario, and in particularly locally, we've seen a significant exponential change in the way that we're dealing with COVID-19. And of course, as we know, and as we look and listen to our medical experts, the reality is we can anticipate the continuation and the spike and some of the pieces. And so it's important for us as a police service to ensure that we're ready, to ensure that we have our emergency preparedness ready to roll. And I want to assure the community that we've actioned our role and our portion of the pandemic plan, the Regional Waterloo Pandemic Plan. That is being led by Superintendent Tom Bursey, Inspector Zima Dietrich, who oversee those areas, and we've fully operated and have fully put that into action. And so what does that mean to the public? We'll continue to provide a high level of policing, although there will be changes to how we provide policing. We will be announcing today the postponement of the Citizens Police Academy, all community engagement sessions, all community meetings. We'll be changing the way that we recruit. We do large-scale testing where we bring recruits into our facility, and we'll be putting a number of series of items in place to ensure that our workforce is protected. So that's one of the key items that we have to do as a police service is we need to ensure we're a 24-hour, 7-day-a-week operation. We need to ensure that our members are properly protected, to ensure that our members are able to respond to emergencies in our community. And so we'll be announcing later today a series of decisions around the police service. So for example, as we postpone a number of community events, community engagement sessions, our community meeting rooms in all of our divisions will be closed for the next 3 weeks to ensure that we promote and lead the importance of social distancing, and equally all travel for all regional police service employees for the next 3 weeks is postponed outside of the region, and so any courses and or business travel is postponed. That being said, we will continue on a case-by-case basis. We have a number of major investigations that take us in and out of our region. We'll continue to monitor the impact on our workforce. We conduct daily briefings as to how we're managing as a police service, and of course, as we look to the future, we want to ensure that we have the necessary personal protection equipment for all of our members, and our focus is really around protecting our workforce. And so you'll see a lot from us around social distancing and ensuring that our members are protected, and equally non-essential members, the opportunity to work from home and to do business differently organizationally will all be put in place. We'll be rolling all of these series of initiatives out, and of course we do this in partnership with our friends and colleagues at the Public Health Unit as we continue to move forward. We're an active partner in the Emergency Control Group, and so of course, this leads to some of our major events that are coming up next week in our community this weekend. I think we can all pause for a moment and look at the number of cancellations of, professional sports teams, community events. A number of things have been happening around us, and of course, it begs the natural question around large gatherings and mass gatherings. First, I want to reassure the community that we already have a significant operational plan in place, which is designed to deter and to limit the unsanctioned event around St. Patrick's Day. And so we've been working very hard. Our team for the last 12 months has advanced and progressed a new approach. We ran a series of pilots at homecoming where we saw the crowd decrease significantly, and our intent already for this event and for St. Patrick's Day was to ensure the ongoing deterrence and the pushing down of the crowd sizes. One of the mitigating factors that has raised significantly, particularly over the last week, is the impact of COVID. And what does that do? Our service has been receiving ongoing information both provincially and locally from Medical Officer of Health, and of course the Ontario Association of Chiefs of Police is very active in these dialogues. Later today I'll be participating in a province-wide call with the Greater Toronto Area Chiefs around the impact of COVID, around the impact on policing, as well as how we manage events. And for this particular event, as you know, we are bringing in outside police support, and that will continue to occur. We'll have members of the Ontario Provincial Police Service and Peel Regional Police Service joining us next week to ensure a proper and appropriate policing plan for St. Patrick's Day. And so, of course, we're appealing to the good sense of our citizens. We're taking responsibilities as an organization, as a community, as community leaders, canceling travel, canceling the way that we do business. And so we're reaching out for a community appeal to ensure that all of us play our role. We all have a part to play. And you know, when I yesterday was engaged in dialogue with Mr. Bruce Lochner, the Vice President of Ontario Health for Southwestern Ontario, much of our dialogue was around protecting our workforce and doing business differently. So, for example, all of our senior leadership team meetings from here on in for the next 3 weeks are via teleconference to ensure that we do business differently. And so we know that mass gatherings, and we know that when people come together, the opportunity for communicable diseases to spread are significant. And we have a responsibility to contain. We have a responsibility to isolate. We have a responsibility to ensure that we do our part. And so we all know that this can be done by our community taking a leadership role, by playing an active part, and making the right decision. I believe, and our police service believes, and we support the notion and the comments of Public Health and Dr. Wang, that all of us have a responsibility to ourselves, a responsibility to our neighbors, our responsibilities to the communities, and more importantly, I want to protect our members, our first responders, and our emergency workers. And so by not attending mass gatherings, by taking responsibility and not going to events and not celebrating, they can do their part. They can do their part by creating social distancing, by limiting interaction. We will not spread the virus. And so, again, believe that those that engage at St. Patrick's Day have the power, they have the responsibility, they can assist us in slowing and containing the spread of COVID-19. They can keep our community healthy. And so the message is clear to all of us. Stay home. Stay away from large gatherings. Stay away from big shopping centers. Stay away from areas where the potential for the communicable disease to be spread can occur. And that includes on St. Patrick's Day, in the University District, and on Ezra Street. Our message is clear, is please do your part. I hope that all of us ask ourselves, is one day worth it? Is it worth getting sick? Is it worth making others potentially ill and sick? Is it worth endangering ourselves, our community, and for myself, our members, our police officers who are required to continue to provide policing 24 hours a day through this pandemic? And so our message is it worth also overburdening a healthcare system that is already facing significant challenges? Let's support our experts. Let's support public health. Let's support our emergency rooms and our doctors that provide critical care every single day to our community. And more importantly, care about ourselves, care about your families, care about your community, and please, we ask that all stay home and do the right thing. That being said, we deal with society, and we will have an operational plan in place, and I want to reassure the community that our operational plan is significantly well-resourced, significantly well-planned, and will be executed and implemented with precision and under the leadership of Superintendent Bursey, Superintendent Goodman, and overseen by the executive leadership team. So, again, I want to thank everybody. There'll be more information that will follow today on some of the activities of the business continuity of our police service to ensure that our community is aware, hours around the police reporting center and records checks, and moving towards online opportunities. Those things will flow out to the community through our normal messaging to ensure we continue down that road. But equally, as you're aware, the Emergency Control Group is meeting today. We continue to work with all of our stakeholders and partners. I do anticipate that we'll continue to receive updates and information, but I also encourage our community to follow the leaders in this. And that's the incredible leadership of Dr. Wang and our friends at Public Health and our colleagues at Public Health who have done a remarkable job of keeping all of the stakeholders, including our police service, up to date. So thank you very much. Look forward to your questions, comments, and I'll open it up for dialogue.
Why not close down the street entirely, Ezra Street? Like, why not just have that area closed off and ensure that no one is there?
Well, again, so operationally, we have a significant plan which is designed to deter crowds. There'll be crowd management pods. There'll be street closures in place prior to the event. And so the community and the public will see a number of initiatives that were put in place for homecoming that will be really enhanced for St. Patrick's Day. And so, again, I do not speak to specific operational issues, but you'll see a series of enhancements. But of course, we've been having this conversation for 6 years, and the easy answer is, well, just like close the street. And it's a much more complex approach, and it's a much more complex problem, and we're working towards implementing the task force recommendations. And I think, our responsibility is to appeal to the good sense of humans, to appeal to the good sense of citizens, to appeal to the good sense of individuals to do their part and play their role in ensuring that we limit the impact of interaction, that we encourage social distancing, and we do it with a collegial approach to managing the issue. That being said, our team will be there. We'll be ready to manage any activities that do occur, but we're making a public appeal to do the right thing and to play your part in a safer community.
Well, Chief, can you talk about your members and protecting your members? So on that day, if you have to be out there because people aren't listening to your message, what precautions can your members take? So officers, will they be wearing masks, gloves? What precautions are you suggesting that they take?
So we will do a risk assessment. Again, all of our divisions, we're enhancing sanitization, we're enhancing all of our fleet vehicles, the sanitization, the cleansing, the cleaning of all of those processes. All of our members are currently issued personal protection equipment. That includes nitrile gloves, it includes N95 masks. Our public safety unit, our emergency response team also have higher levels of mask. And so again, that will be led by our operational folks who are overseeing the event. They'll make organizational decisions based on risk assessments, based on consultation with our colleagues from Regional Waterloo paramedics and public health as to the risk assessment, and we'll make those as the event progresses. In an ideal world, I think they're calling for 7 degrees, a little bit of sun, and in an ideal world, everybody will have heeded the message, and there'll be a lot of police officers, and really not a lot of citizens, which will allow us to actually then redeploy and actually scale back our operations. So again, we're ready for all of those processes, as we are every single day. Every single car across our region is equipped with personal protection equipment, and we'll continue to roll that out. But that is an operational decision that will occur based on risk assessment, based on medical advice, and based on the expertise of our colleagues at paramedics and public health. But we're ready, and we're geared up, and we've also enhanced all of our internal methods around cleanliness and hygiene and all those processes.
What about in the entertainment district that evening? Because kids really do congregate there in large groups. And again, it's free will and they can be there. But I guess what are police doing to kind of mitigate some of that? Like, are you meeting with some bar owners who may have, extra special night that night and so encouraging kids to come out? Or like, how do you kind of deal with those crowds that are going to show up on the street that night?
Well, again, I think it's really appealing to good common sense. I don't think that, I think all of us, if we pause for a second in our own personal lives, have likely changed our patterns and likely have changed our behaviors. We've all likely taken a different approach to how we do business. And I truly have confidence, and I truly believe that when we're making an emotional appeal here to those that may do that, is that, when you look at Toronto, Montreal, New York, Chicago, which are all celebrate St. Patrick's Day with great excitement, parades, they've all canceled it because the community is far greater than one individual having a good time. Community safety and the greater good of all has to be at the heart of everything we're doing here. And so our North Division team that has a relationship in our Uptown Entertainment District is having those dialogue. And we're also awaiting, we anticipate further information from Public Health around guidance, around sending a larger message around gatherings and public events. We anticipate that Public Health will take a larger lead in some of those things. And so this is evolving at a rate, that is nonstop. Most of my days have been basically totally retransformed and have been very focused on emergency planning, emergency preparedness, and COVID. I can tell you that our leadership team are probably frustrated with me because I keep changing their schedules and calendars and making them come on phone calls. We're working literally around the clock to ensure emergency preparedness. And so that's kind of what we're doing, Liz. It's evolving at a greater rate. If you go to Public Health Canada and the Regional Waterloo Public Health site, they're two excellent websites, and if you consistently click and refresh, they're updating consistently as we learn more and as our medical experts provide more information and guidance to us. We're not the experts. We're an emergency services that finds ourselves in the middle of all of it and finds ourselves in the middle of it. My one caution continues to be that our crowd management team has a very well-planned and it will be a well-implemented plan that it will happen regardless of what happens. We're not scaling back operations. We're ready to roll, and we're going to do it with great professionalism, great pride, and I'm confident in our leadership team that is overseeing that.
Dr. Wang has the power to stop large gatherings, and you kind of alluded to that part that she can really speak to that, and maybe she will later today. But I guess is she looking to you for advice, because as the police chief, you're the ones policing that area, and has she come to you for advice as to what you would think and how to shut that down if you could?
So we're working very closely with Public Health, and want to echo my public support for Dr. Wang. She's kept all of the community leaders and myself as the chief of police up to speed with incredible information, has provided strong guidance to myself as the chief of police, and I take my lead from Dr. Wang. She's the expert, and not only is she an incredible health professional, she's an incredible community leader, and I anticipate as the Region Emergency Control Group meets today that further information will flow after that meeting, and I anticipate that's the ever-evolving nature, so I understand there's trepidation. I also want to be very clear. We appreciate all the feedback from the community. We appreciate the trepidation and the concern of the community. We hear them loud and clear, and I want to assure the community we're actioning and we're doing everything we possibly can. But the information changes hourly, and so we're consistently revamping and retooling as a police service. And so we want to make sure, and this is, I'm encouraging all of us collectively to make the public appeal about doing the right thing for the greater good. Now, there's nothing better than being a citizen where you actually do something for the greater good, and that's what I'm appealing to. That being said, I have a responsibility as the chief to be ready to go, and I want to reassure the community we're ready to go.
Are you hearing anger from the community? Because we are in our newsroom. People are saying, you guys need to use the Riot Act. You need to do something to completely shut this down. And there's fear. Like, they're afraid that this is going to spread this virus. Is that even an option?
Well, again, we always assess. We've had lots of discussion over the last 6 years about the Riot Act, which really dates back to the 1700s. So when we look at the historical context of that, Kate, we have heard from the community. We continue to receive emails. We understand the fear and trepidation. And that's our public appeal. Our public appeal to those that may choose to go is, care about your community, care about your family, care about your own personal wellness, but this is the world we live in is really around making adjustments and change, and that's the appeal we're making. So again, we do risk assessments and we look at operational planning and we look at all the different pieces as we roll through this. That's always ongoing. We obviously, the task force had 4 key recommendations. We're advancing those and moving those forward. We've seen some success in decreasing the size of the crowd, and we also anticipate, we're heading into March break next week. Our public schools are closed for the next 3 weeks. If you include March break, we're seeing that some post-secondary institutions are changing some of their pieces. Everything is moving at a fast rate, even when you think about it, Disney, the happiest place in the world, is taking a break. Parliament is suspended. These are serious issues, and we're appealing to the people, the demographic that attends this event, to recognize the seriousness of this particular pandemic that we're dealing with. It's, again, something like we've never experienced before. We're all dusting off our 2008 pandemic plan from H1N1. When you actually think about it, historically, that's the last time we actually really were this involved in emergency planning. And so we're all dusting it off, but I have confidence in all of the stakeholders, and I'm putting my confidence in the community. I'm putting my confidence in the voices that have been calling your newsroom, that have been on social media. I think other people are hearing those voices, and our passion and our passionate plea is everyone has a role to play, and it's about even making that decision, whether you go here or there. It's about good citizenship. It's about, do you really need the 10 rolls of toilet paper, or can you actually leave somebody a couple of rolls for somebody that is really in need? I think we all have a role to play in that.
Are you at all concerned about this passion of people who are like stay home evolving into something more violent on Tuesday? If there's sort of people that are like stay home and people are out there partying, that other voice becomes an issue?
Well, we're always concerned. Again, our role as policing is to be in the middle of democracy. Democracy is messy, but I'm very proud of our front line. I'm very proud of our public safety team. We do that consistently to moderate and to manage the various opinions. And that being said, though, I want to be very clear. I support the call and I support the voice for ensuring a healthy community and doing the right thing. And that's great, but I also have a responsibility as the Chief of Police to ensure that our membership and to ensure that our team is ready in case those don't heed that emotional appeal or do not follow recommendations from our medical officer of health, from the provincial chief medical officer of health, and from the federal medical officer of health. We deal with society, and we know that sometimes people choose to make their own decisions, and so we'll be ready to deal with that, Kate. So thanks very much, everybody. Again, we'll continue to keep you updated. You can expect more correspondence from our police service later on today. And again, thanks everybody for short notice and accommodating my schedule. Thank you. All the best.